Okay, sorry. I think I'll just move on with my slides. I'm a little sorry that we got cut off. I'm good. These are the areas I intend to cover, and I think I'll go straight into it. The COVID-19 situation at the moment, this of course is correct as of 8th of July, is that we've got just close to 12 million cases with 500,000 confirmed deaths. And you can see in this slide, which is from WHO, you can see that by the color of the on the map, the intensity of the cases being reported, and it really is a global pandemic. It's nothing that we've ever seen before in our history. This is Singapore. We have 44,000 cases registered. A lot of them are mild, but obviously we've had 26 deaths, and I think there are a couple of deaths that have been associated with the illness. We're not sure that it's caused by, but it's still a significant number. It's very close to what the number of lives we lost during the SARS epidemic back in 10 years ago. Sorry, 20 years ago, almost 20 years ago. I thought it'd be interesting to show some comparative rates of the infection between Pakistan and Singapore, since most of our audience is from Pakistan. You can see that our infection, at least based on this epidemic chart, suggests that we've reached the peak and its numbers are coming down. And of course, this is compared across Asia. One has to be careful in this instance because this infection is a little bit more common than the more dangerous forms of coronavirus like Ebola and the original SARS, largely because it's relatively easy to spread both through direct contact or fomites, and therefore we still have to be very careful. In fact, in Melbourne, they've locked down the city again for 6 weeks. So this is not something to be scoffed at. The other piece, and I have a slide here to just talk a little bit on this issue, is death. Now, death doesn't affect the young as much as it does the elderly. And you can see, although it's a complicated chart, if you can watch my pointer, you'll realize that if you're below 45 years of age, the risk of death is actually very low, it's 0. But the moment you get above 65, death rates are actually significant. And this is the same across the world. Now, what about the Institute of Mental Health? We're a very large hospital. We have 2,000 beds and multiple services, both for adults, children, and the elderly. I also thought it'd be useful to compare, between Singapore and Pakistan, a little bit of our demographic. Now, Singapore's a really tiny dot. If I didn't put the dot here, you probably can't see it. Our land area is really only 716 square kilometers. And this is really in low tide. Pakistan, you have many times our size, and you also have a much larger population. We ethnically, we have 3 main races: the Chinese, the Malays, and the Indians. And this is our infant mortality and life expectancy. We do have very good health metrics, at least in the general outcome data. But this is where Pakistan is, and there are some differences. I think Pakistan, you're quite variable depending on which part of Pakistan you're in. But it's always useful to look at some of these demographics before you think about the systems. Now, Singapore has a healthcare system that is regionally based. We have 3 main regions that we divided our healthcare system: the West, the East, and the Central region. Our hospital actually, although it's the National Tertiary Center for Mental Health, is actually part of the Central region. Now, interesting thing about our mental health services and our public health services is really the fact that our primary care is only 20% are publicly provided. 80% are private GPs or family doctors. On the other hand, general hospitals, majority are public services, and we have much fewer private hospitals. Now, a little bit of our history of the hospital. We started in 1928, but it was essentially a mental asylum for the mentally ill. Only in the late 60s to 1970 when we started child services, and then we had an inpatient unit that was started in 1982. So this year, in fact, we're celebrating 50 years of child psychiatry in the hospital. Now, this is a little bit about the details of our hospital. we look after the most severely mentally ill. Because we are a very small country, it's essentially a city-state. Most of our mental health services actually emanate from our hospital. Our hospital has about 90% of the psychiatric beds in the country. And this is the total number of visits on a daily basis to our outpatient services. And of this, about 10%, 52 child visits for every 580 adult visits. And we have one child admission for 24 admissions in total during a day. Outpatients, we take care of about 46,000 adults and about 13,000 children and adolescents. And in our inpatient unit, it's a 20-bedded inpatient unit. We have usually, on average, about 11 children and adolescents who are admitted in this unit. In terms of acute care, like I said, 11 child adolescent. We don't really have long-term care for children, but we have about 1,000 long-term care patients in the hospital. Now, why am I telling you all this? This is important because this hospital essentially is a large tertiary, long-term, intermediate care facility apart from acute care that we provide. It does mean, and I don't know whether you are aware, during the pandemic, there were many mental hospitals that were affected by the pandemic, and there were many deaths, particularly in Korea as well as in China. So we were taking reference from that, and we had to be very, very careful. A little bit about the staff strength. The total hospital staff strength is about 2,470, but for children and adolescents, it's just about slightly over 10% of that. So just over nearly 300 child adolescent mental health professionals working with us. This is the kind of spread we have in our hospital. Now, what about the child and adolescent mental health ecosystem in Singapore? I think it's important to sort of understand the ecosystem and how it works. It's different in different parts of the world. What we've developed is national centers as well as regional health systems and then schools. Now, schools and social systems actually integrate within the health system. So this is uncommon. In most countries, the health system is apart from the schools. What we've done is to try and integrate it so that mental health services are not driven by people going to hospitals and clinics, but start in school. And we have school counselors as the starting points. There is a pastoral care team in schools that will manage mental health issues. And then our teams actually go to the schools through the regional health systems to provide services. And they have tools within schools for looking after that. So in that sense, the care is very much a population-driven at the base of the pyramid, and then it allows our tertiary services to function the way it is. That's why we have 11 beds for the whole, we have 20 beds for the whole country, even though we have close to 1 million young people below the age of 18. This is how the services work in our ecosystem. We also have these linking services. One of them is a drop-in center for youth, and the other is a sort of child mental health team that works within schools. So every school has a child mental health team that will come to them, and they have dedicated mental health professionals that work with the schools. So for our hospital as a whole, this is our vision and mission, right? It has nothing to do with mental health, but it's talking about health as a whole, because health is holistic. We cannot separate mental health from physical health. So adding years of healthy life is our overall vision. But our mission is to promote mental health as well as provide services, including education and research in mental health. So during the COVID-19 pandemic, we actually had to create a strategy to manage not just our business as usual, day-to-day essential mental health services. We need to protect our patients and our staff because our patients are very vulnerable. It's been shown in around the world that mentally ill are vulnerable to to pandemic infections, as well as the fact that they have higher mortality, largely because of metabolic syndrome, which is diabetes and hypertension that's associated with many of our patients with mental illnesses. We needed to preserve our resources as well, personal protection equipment, as well as our manpower to sustain the effort for a prolonged period. And of course, at the same time, because we're a national center, we need to support the national infection control measures and support our national healthcare system, particularly the mental health of our country. I'll talk a little bit to that. I'm going to now share with you a video. I hope you can hear the sound.
I want to start by first thanking all Singaporeans and residents of Singapore for working so hard over the past few weeks in helping us to bring the outbreak under control and significantly reduce our infection rates in the community. Because of all our collective efforts, we are now ready to exit the circuit breaker, and we can now start planning to resume activities safely and in a phased manner. I want to start by...
Sorry. Wait, hold on. Let me just make sure that we... Okay, so this is a summary slide of that video. That video was made because we also needed to encourage our staff. It was difficult under the working circumstance for mental health services to proceed. We have a whole series of things that we have to get people to adhere to, apps to enter places, to keep track, disinfection. So it has changed our whole practice somewhat. As a result of, now there's two situations that DORSCON Orange was the national alert system that said that we have community spread and we needed to buckle down, introduce infection control measures across the country. Circuit breaker was our lockdown. So when lockdown occurred, a lot of our services, our traditional services for admissions, emergency, outpatient, even community services dropped. And we had to pick that up again, but in a different way. So it was quite critical. The first thing that, if you've noticed the video, is really this issue of telepsychiatry and the ability to provide services. Now, this is a paper that was written by a number of young psychiatrists from around the world talking about their readiness to really do telepsychiatry. Unfortunately, I'm not sure whether Pakistan is here, but we can see India. There is not readily available a lot of informal telephone. In Singapore, we actually were preparing to use telepsychiatry, and we've been considering telepsychiatry even before this pandemic. We've created ethical guidelines. We've got a guideline for clinicians to use telepsychiatry. And remember, it's a whole new practice, so the standards of care that's needed and how we practice has to be taken into consideration. And of course, even in our licensing services, we're moving away from a a service that's based on premises to a service-oriented license. So again, telemedicine would be licensed. It's actually in phase 3 our implementation, which was supposed to be 2022, but we've pushed it forward largely because there was a need. Now, a lot of people have talked about this emotional epidemic that follows the infective epidemic. And this is one thing that one has to take into account. Now, I know it's a complicated slide, but what it basically says is with COVID-19 and deaths that are occurring, there are mental health issues that are associated, the fear, the anxiety, the panic, even the obsessive compulsive persons within the community having mental health issues might become worse as a result of this pandemic. Then there's the lockdown. Now, post-pandemic, there are also other issues because of the financial crisis, the loss of jobs. That could itself bring a lot of problems, and depression and other conditions might emerge. Post-traumatic stress disorder might emerge. In fact, there was a recent study that suggested that about 10% of individuals coming back to work from lockdown situations actually have symptoms of PTSD, coping with the strange situation that everyone is in. This same paper then talked about how to prepare countries for this whole emotional epidemic. And so it was important. The only problem, of course, is mental health professionals generally in most countries are much lower than their physical health alternatives. So are we able to provide that care? So that's something to think about. In Singapore, we've actually spent a lot of time thinking about this. Well, firstly, we know that we have a population that we have to look after, and we have providers, healthcare professionals working in the front lines, whether they are dealing directly with pandemic patients. In our case, in our hospital, we had a mini outbreak in our hospital. We also had to deal with pandemic. So the providers and the population had to be provided with support. At the same time, there are patients that we have, existing patients with mental illnesses that we have to look after. How do we deal with this? Now, from the population viewpoint, mental health is important. What is mental health? Mental health is really the state, how our population reacts to the stress of the situation. If things are all well, there's no distress. But when there's increased stress, particularly in this pandemic, with all the changes and all the things that you need to cope with, there's often distress and even mental health problems. These are not necessarily illness-based. They're not brain disorders. What they are, in fact, are reactions to what's happening around due to stress. And as we know, stress, particularly in a chronic state, can be very bad for mental health and can create situations as bad as killing oneself. So it is essential that our services could deal with that stress. At the same time, we have to manage mental illness. Do mental illnesses emerge from the pandemic? Possibly, but this is much rarer. So 20% of every population would possibly have mental illness. In order to deal with each aspect, you need to develop clinical services. So technology-enabled telepsychiatry services to continue supporting people with mental illness, but maintaining infection control measures, creating a trauma-informed care system that people understand that if you have an illness, how does it react to the situation around you? Are there new support measures that need to be brought into play? Because COVID itself, what we understand is the respiratory aspects of it. We don't really understand how much it affects the brain. And now there's new evidence that suggests that COVID infections may actually go to the brain. We don't have data on this because the people may not die, but they become very anxious. Viruses can do that to the brain if it crosses the blood-brain barrier. So we don't know about this. At the same time, in managing mental health, we need to be able to provide support. So in terms of crisis care, helplines and chats. So in Singapore, we got a national care hotline that's available 24/7. You can call that line. There's now a website that has information about support at every level, even a kind of an online screening element. There are e-counseling services that are provided by NGOs. And there is also an app, what I call an asynchronous support. This app is being developed with this company called Wiser, which was developed, which originated in Bangalore in India, and it's quite well used. It's a little penguin that helps to support you. Asynchronous means it's synchronous, but there are no people behind it. It's an AI robot chat kind of thing. So some of this may be necessary. In the longer term, obviously, for mental illness, I think there is importance for people to, we're taking this opportunity anyway, to create training in the mental health gap. That means teach frontline doctors and other clinicians about mental illness, and take the opportunity to drive in the anti-stigma initiative. So in Singapore, we have a multi-year anti-stigma campaign called Beyond the Label. So this year, actually, the focus is on youth. So we're taking this opportunity to try and fight the stigma. At the same time, we need to provide psychological first aid training and mental health literacy training for the general population and for frontliners. So this, in essence, is kind of the strategy that probably needs to be done. At the same time, because I'm the president of YACAPAP, I've also therefore leveraged on the International Association of Child and Adolescent Psychiatry and Allied Professions. That's our website. Please go and visit it if you're interested in finding out what we can do. We have an online textbook that can probably educate you about child and adolescent mental health. There is a online training course called a massive online course, MOOC, that is available free of charge. Our textbook is free as well. You're welcome to go and download. Unfortunately, I don't. It's largely in English. There are other language versions, but I'm not sure that all your various ethnic languages in Pakistan is addressed here. We also have a journal that has information that's relevant, and obviously we do have a website that has information about what you can do about child and adolescent mental health. So some of the questions that you've asked might be available there. And there is going to be a free webinar on the 20th of July. It requires you to register. If you go to the website, you can see that. And again, I would urge you to register. Now, I think I've come to the end of my slides. And unfortunately, yeah, time is running out as well. But Saira, you...
We have a number of questions, Dr.
Okay.
Fung. So I can read some of them out and see if you could be kind enough to address them.
I will try to do that. Let's go through some of this. How can we raise our children in such a pandemic situation? Well, I think the important thing is you do want to normalize things for children. So for young people, trying to even in the midst of some countries have, and some areas have lockdowns and no school or do home-based learning, I think it's important to allow some normalcy to go back into that. Obviously, it's hard in the home environment to learn, and if you don't have technology, I'm not sure how that works well. But try and normalize life as much as possible and continue living. It's very difficult for kids if you stop everything and you prevent them from experiencing life as it is. The other thing is not to overexpose them to information. Some information, and I believe WHO actually has a website that has a story to talk about COVID-19. Share that story with them, but don't overexpose them and don't scare them unnecessarily, because children are likely to react. And of course, as adults, you have to take care of yourself. Now you have to explain things like the hand washing is so important, why the wearing of masks is important, so that it protects you from if you are sick and from you spreading to others. If everyone wears a mask, there is a good chance, even if you wear just a reusable mask. So those kind of lessons are important. At the same time, you want them to continue to go to school and have their daily living conditions as much as possible. For older youth, I think the importance is about space. When everybody is staying at home a lot, you need to give time for everyone to have their own space, and it might be helpful in families. I usually recommend that you have time where everyone doesn't communicate too much. They just do their own thing for a bit before they come together, because there's so much time together. And tips on how to improve my child's mental health. My daughter is 11 and she has short memory. I'm very disturbed. Well, it's similar to what I've just said. I think it is important at the age of 11. You're talking about a preteen, so or even a teenager, depending on when puberty arrives, and you need to be able to help them manage the information. I think this information management, this fear and anxiety that people have, sometimes it rubs off on the children the wrong way. So you have to help them to sort of understand the situation and say, look, this is a new normal, but life goes on. It's not going to end here. And at the same time, if schooling is an issue, can you do some of that at home? But of course, some of us are working from home. So I've got a setup here at home. I actually see patients from my home, but it's more difficult because it's a change. And then my kids are all grown up, so I don't have to raise them. But if you have to manage them, you have to find time to do all these tasks, and you need to be able to separate that. How to get rid of negative thoughts? Have positive ones. Obviously, we all have negative thoughts. I mean, if I think badly, I could say, oh, the pandemic is in the community. There's community spread. In Singapore, we're in DORSCON orange. That's the next thing to red, And if we think that way, we'll be very frightened. At the same time, we could say, well, there is spread, but there are ways that we can protect ourselves. We can go out, we can wear our masks, we can wash our hands, and the risk of catching COVID-19 is much less. And then you could, positive thoughts change our negative thoughts. How to ensure the healthy well-being of my college students? I think the most important thing is a change in our way of, how would I say? We talk about social distancing. It's actually physical distancing, so that stand more than a meter apart or even 2 meters when you greet people. Don't use the usual thing, or handshakes might be difficult. So what do, right? You can smile, you can wave, you can do the elbow rub or the fist pump. But then remember, always wash your hands, always wear a mask. It does change our dynamics in the way we interact, but doesn't stop us from creating social connectedness. This is an example. Here I'm having a conversation with all of you, all over the world. In the past, we don't have that. There's some new ways of doing things that will keep up that socializing, which is quite important. So college students, they need that social interaction. So I think more and more of this video meetings might be a way to go forward, and it actually creates the connection in a new way. How important is pastoral care in schools? It is extremely important, because if you don't have pastoral care, it means that you are focusing only on the educational aspects, but life of a child, a young person, is also about the social aspects and the emotional development. So you can't divorce the two, and you need to bring them together at the same time. So pastoral care, counseling, looking after the social emotional needs are quite critical in every school. And every school should have either teachers or even dedicated professionals. In Singapore, we started back in 2008 to have one school counselor. We now have at least 2, and in some schools who can afford it, they have a lot more. So it's really up to the school and the resources that they have. Could schools offer telepsychiatry? Yes. So when we went into lockdown and we DORSCON orange, we didn't stop our services. We went online. So very much like what we're doing now. Instead of seeing Syra Butt on the other side of the thing, I would be seeing a teacher or a counselor, and we would be discussing, and the parents and the students can be seen. You'll be very surprised when you do telepsychiatry. You actually see a lot more, because you can see the children and the families, which in the past, very often only the mother will come and they'll bring them, and they'll be waiting in the long clinic. Waiting queues. Now it's actually much better. The queues are there. We still have a waiting room online, but it still works.
Wow.
What kind of problems could school and teachers face after the lockdown? I think, like I said, I think some of the issues would be linked to worsening of existing problems. The other is that as a result of the pandemic and the economic recession that is to follow, adults may be affected. And when adults are affected, children will be affected. How are teachers affected? Well, if your school's resources are affected financially, that would have some impact on you. So I think those are the things that we're probably most concerned about. And most governments are concerned about this. I know the Singapore government actually budgeted an extremely large budget, largely because of some of these concerns that's going to happen in the next couple of months to years.
Dr. Fung, I'm going to have to stop you there. Unfortunately, we've run out of time. Going to thank you on behalf of Beacon House, the organizer of School of Tomorrow events. Thank you very much. Thank you to the viewers, to our lead sponsor, United Bank Limited, for making this event such a success. And I do request our viewers to provide feedback on this event on our website. Thank you very much. Do join us Sign in tomorrow. We've got many more sessions coming up. Look forward to seeing you again. Thank you, Dr. Fang. I have thoroughly enjoyed your presentation, and I do hope that we can keep in touch.
Take care.
Thank you very much. Goodbye.
Okay, bye-bye.